Hello, Yale students. My name is Roberto and I am a physician from Brazil. Last year I was a TA like Jeremy and the ones with you today, and in the process of preparing our first review session, Mark remembered my look and the way I reacted in my first few classes of HBA 510, in which I seemed very astonished with the features of the US healthcare system, and he asked me to come up with a list of these 10 most astonishing aspects of the US healthcare model. So this year, since I won't be able to be personally with you, I they asked me to produce this little video, and I would like to share with all of you this list that I wrote down last year. So let's start with that. The first thing that caught my attention was to realize that the United States spends so much money in healthcare, and about 15% of your GDP, but the health outcomes of the population are either the same or worse than other industrialized nations. And I must say that even some developing countries that spend a lot less. Second aspect was that even though you spend so much money, there was still a huge amount of people, 47 million last year, that had no coverage whatsoever, whether public or private, amounting to roughly 15% of the population. So, why was that, and what other aspects were surprising? The third one was that I noticed the pharmaceutical companies were allowed to directly advertising prescription drugs to patients, treating them as consumers of drugs, not as patients, often leading to overconsumption of drugs and even misuse of those for purposes that were not originally intended for. Fourth was that I noticed the lack of general practitioners, or how, as we call it here in Brazil, family physicians, in primary health care. So you had most of the primary care, if you got any, was provided by other types of providers, usually nurses, and that seemed unusual for most healthcare models that I'm aware of. And luckily for you, your nurses seem to have fairly good preparation for that role, which would probably be unlikely in other contexts. But that's food for thought. Fifth thing I noticed was that insurance companies had the right to deny coverage to anyone they saw as costly or for any other reasons. So the burden was on the person to prove that they were worthy of being taken care by a given insurance. So instead of you as an American citizen or permanent resident having the right to health and healthcare, the insurance companies had the right for you to choose who they wanted to cover. Six, sorry, you lacked a national standardized basic coverage that all insurance companies had to offer. So it was very difficult to pick and choose which health plan was most adequate for your needs and which one provided the best value for your money. Seventh characteristic was the lack of portability. So once you moved out of a job, whether you quit or you were fired, then once you got another one, you were very likely to lose the coverage you used to have and had to start the process all over, or finding a new provider and getting a new prescription plan and almost starting from scratch, often losing what you had before. The eighth characteristic was that these plethora of providers and insurance companies led to extreme fragmentation of the market and also segmentation with a lot of overlap. And all these asynchronies led to waste and inefficiencies. The ninth characteristic that I noticed that also surprised me was that tobacco sales and use was not regulated by a health authority. Instead, it was regulated by the Federal Trade Commission and treated as any other commodity, not as a health hazard. Luckily, I read recently that seems to be starting to change with the new powers being assigned to the FDA to regulate tobacco market. But the effectiveness of that remains to be seen. I wish that it really works and you can get your consumption down. Finally, the characteristic that was most surprising to me was that instead of the insurance companies having to cover the sick and the poor, they were free from that. I mean, the government and all the taxes that you pay were channeled to provide healthcare to the ones that really need and are the most costly. So the burden was all upon your government to cover the poor, the sick, the elderly, and other vulnerable populations, whereas the insurance companies were left with the cream of the insurance market, of the healthcare market, which is the healthy, the young, and the sick, all free to make their profits while you pay to treat people who actually need to be treated for. So those were the 10 points I wanted to highlight, and I truly hope that this bring you some characteristics and some ideas to reflect upon, and I wish you the better luck in changing that situation. I wish you a great semester and thank you for the opportunity to talking to you again. Bye.